Well, President Biden is working during his second day of isolation as he recovers from COVID-19.
His administration is trying to use his diagnosis as a teachable moment. Mr. Biden is taking the antiviral drug Paxlovid. The president is fully vaccinated and double boosted, something his doctor credits for his mild symptoms. That's a quote there. The White House chief medical advisor, Dr. Anthony Fauci, spoke with CBS News earlier today and said the president's diagnosis is a reminder for why it's so important to get protection against the virus.
We've done very well. We've done a lot with regard to vaccinations and testing and drugs and antivirals since January of 2021, but we still only have 67% of our total population vaccinated, and only about a half of them have gotten boosted. If someone has not gotten a boost in the calendar year 2022, they need to get a boost.
CBS News Chief White House correspondent Nancy Cordes joins us now for more. Hi there, Nancy. So the White House did release an update from President Biden's personal physician. What did we learn?
Hey, Elaine. Hey, Christina. Yes, we did just receive this letter from Dr. Kevin O'Connor with a few interesting new details about the president's condition. Dr. O'Connor says that President Biden's symptoms have improved, that he did mount a slight temperature yesterday, 99.4 degrees, higher range of a normal temperature, but that elevated temperature responded well to Tylenol, which the president took for discomfort. His symptoms remain the same: runny nose, fatigue. His cough is a little looser now than it was yesterday. His voice is a little deeper, but all in all, he says that the president is doing well.
Now, we're going to be getting these daily written updates from the president's doctor, but unlike when former President Trump had COVID, as of right now, it seems like we're not going to get a chance to talk to Mr. Biden's doctors. They're not going to participate in these press briefings with reporters. Why do you think that is, especially for a White House that says it's all about transparency, especially with the president's health?
The White House hasn't explained why they are not making Dr. O'Connor available. They're simply saying that they're being extremely transparent by releasing all of these details, by having regular briefings with the White House press secretary, Karine Jean-Pierre, and the director of the COVID task force, Dr. Ashish Jha, who himself has been in regular contact with President Biden by phone. He's not observing him directly, obviously, but he has been speaking with President Biden. And White House officials say that that's enough, particularly in the light of how mild President Biden's symptoms are. They say he's fully functioning. He is conducting business as usual, albeit via phone and Zoom rather than in person. They are still going to get those questions, however. I imagine that there will be a lot of questions at the briefing this afternoon, once again, about why we're having to learn the details of the president's condition secondhand through Karine Jean-Pierre and through Dr. Jha rather than from his doctor himself.
Well, Karine Jean-Pierre, as you know, was questioned by reporters yesterday when she said that it didn't matter where the president got COVID. And that seemingly goes against administration policy on things like contact tracing. So, Nancy, do we know, are officials trying to pinpoint precisely where Mr. Biden caught COVID?
I think what she was trying to say, and she clarified it a little later, is that as far as the public is concerned, they're not looking to scapegoat or blame one particular person publicly for giving the president COVID. But there's no question that behind the scenes, that contact tracing is taking place. In fact, we're expecting to learn later today just how many White House officials, White House aides, are now considered to have been close contacts of the president, meaning that they were with him for more than 15 minutes, closer than 6 feet apart, without masks, over the 48 hours prior to him being diagnosed. But they're simply not interested in putting out a name and saying, here is the individual who we think most likely gave President Biden COVID.
All right, a lot of people in that potential circle. Nancy Cordes, thank you so much.